Welcome, welcome, welcome. Today we are here to talk about, can PCOS affect pregnancy? I'm Dr. Perkins, so thank you for being here, and let's dive into this conversation today. So while we will cover quite a few things today, we'll start by talking about PCOS and giving a very brief overview of what it is. We'll talk about pregnancy and PCOS. I'll give you a few tips on how to manage PCOS in pregnancy, and we'll finish up by talking about how PCOS affects the unborn child, as well as postpartum changes in breastfeeding. All right, so let's quickly recap PCOS and what it is. All right, so PCOS, Polycystic Ovary Syndrome. This is a very, very common condition that affects upwards of 10 to 12% of the reproductive world, on the female side, that is. And really clinically, as a physician who deals with PCOS on a regular basis, I'll tell you that I really think that the numbers are much higher than we're seeing by the statistics. And that's because a lot of PCOS patients are undiagnosed. And if they are being diagnosed much later in life when they've been suffering with this condition for many, many, many years. Now, PCOS really presents itself as having three main buckets of what I would consider to be problems. The first is that you do not have regular periods. That means that in a 30-day time span on average, you may not have a period. And in fact, a lot of patients may go even years without having a period, and you're not menopausal and you're not pre-puberty, which means you should be having regular cycles. The only other condition that I would say kind of plays a part here is maybe using birth control. And so if you're not pre-pubertal, if you're not menopausal, if you're not on birth control, or maybe even maybe you're dealing with a condition like cancer and chemotherapy or radiation therapy that may have reduced your hormones and your ovulation, really you should be having regular periods on a regular basis. In PCOS, you may have less than 9 periods in any given year. Second to that is that you may have an elevation or high level of male hormones. Now, it's important to understand that all females will have some degree of male hormones, but that should be the lesser of your sex hormones. The same for males. Males have female hormones as well, but their male hormones are dominant and the female hormones are much lesser in their system. In PCOS patients, the reverse happens, where your male hormones may be a little bit higher. And with that, you may notice that you have excessive hair growth, for instance, where you may have hair growth on your upper chin or under your chin. You may have it on your chest or on your thighs, in places that are much less common as a female. Lastly, you may have an elevation or higher count of what are considered to be follicles inside of your ovaries. With that, these follicles are essentially a house for an egg that is waiting for ovulation. It is growing, it's trying to mature, and the follicles really protected in this state. In PCOS, because you're not ovulating regularly, you tend to have all these follicles built up inside of your ovaries not being released. And so because of that, your ovaries may be larger than average. And on ultrasound, you can see all these follicles being stacked essentially in your ovaries. Now, in general, 2 of those 3 things should be present for the diagnosis of PCOS. Again, those 3 things are not ovulating regularly or anovulation, having a higher level of male hormones, having follicles, many of them, on your ultrasound. 2 of those 3 things are needed for the diagnosis of PCOS. According to the CDC, women with PCOS are at a higher risk of several complications during pregnancy. And so we're going to talk now about what those risks may look like. The first is gestational diabetes. This is diabetes that is specific to pregnancy and pregnancy only, which means that before pregnancy, you are not a diabetic. In pregnancy, you developed diabetes. And then after pregnancy, it goes away like nothing ever happened. That's gestational diabetes. Now, I will put a little pin, I put pins all over the place, but this pin here is to say that there's a small fraction of people with gestational diabetes who will continue to be diabetics, but a very small amount of people. Women with PCOS are 3 times more likely to develop gestational diabetes in pregnancy compared to the average person. So this is the first risk factor. The second is that research has also shown that people with PCOS are at a higher risk of developing preeclampsia in pregnancy or postpartum. Preeclampsia is a hypertension problem. It's a blood pressure issue that affects people in a pregnancy state. When you're not pregnant, usually these symptoms and problems will completely go away. Lastly, studies have shown that people with PCOS are at an increased risk of delivering their babies prematurely. This means before the 37th week of pregnancy. And so PCOS can really impact pregnancies in a significant way. So it's important that when you are pregnant, we take care of our bodies the best way we can so that we can have a healthy baby and a healthy pregnancy, which is absolutely possible with PCOS. So what can you do to manage PCOS in pregnancy? Many things. Now, I want you to not try to really work on PCOS specifically in pregnancy. Pregnancy is a place where you really want your temple, meaning your body, to be able to house this growing pregnancy well, and you want to be able to go through this process as well as possible, right? And you want to come out on the back end well. And so the tips that I'm going to give you now are really more for a healthy pregnancy than it is for balancing your hormones with PCOS. So the first tip is to eat well during your pregnancy. This is very, 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 very important. It means that we're not binging on any one thing, okay? So we're not binging on ice cream, or we're binging on pizza, or even if it's a vegetable. Too much of anything can be a bad thing. We want well-balanced diets. And so that means that outside of the first trimester, which can be just really rough when it comes to eating well and being able to hold things on the inside because of morning sickness and other things that happened, first trimester is just a little rough. Outside of that, we want balanced meals. We want protein. We want carbohydrates. We want healthy fats. And so with each of your meals, breakfast, lunch, and dinner, we want to incorporate those things as best as possible. I will say that in pregnancy, carbohydrates tend to be very important, and for good reason. It is the first source of your energy. It is the easiest for your body to process, and it's also very important for your brain to function well. So you may need a little bit more heavier carbohydrates, but really balance that out with your proteins. This is good practice for those with PCOS, even outside of pregnancy. And so the best recommendation that I have for you here is to incorporate lots of complex carbohydrates, meaning that we want carbohydrates that are not super processed. So things like whole grains, brown rice, oatmeal. These are important and wonderful for helping to stabilize your hormones even in pregnancy. The second, I would say, probably just as important, is to keep moving as best as you can. It means that we're walking every day. It means that if you're exercising, especially if you used to exercise before pregnancy, that you continue that at the same level and the same pace. It means that you're keeping your body outside of a sedentary state, which is very, very important even as you have this growing baby on the inside. Lastly, please, I recommend super hydrating. And by super hydrating, I mean that the typical pregnancy really requires at least 2 liters of water, pure water, per day. In a pregnancy with PCOS underlying as a medical condition, I recommend that you're going upwards of even a gallon of water per day. Hydrate, 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 hydrate. Very, very important. So those are my top 3 tips. Now, as you continue throughout the pregnancy, you may be wondering, well, how do we potentially help to reduce problems with the unborn child as well as with your journey in the postpartum world? So as I mentioned earlier, PCOS can affect the pregnancy, and uncontrolled PCOS can do the same. And so uncontrolled PCOS can lead to miscarriages. During the pregnancy, it can lead to preterm deliveries. Post-pregnancy, it can actually lead to developmental issues with your child as well. And so in order to reduce those tips that I just mentioned, I'd like for you to try to incorporate them in your life as best as you possibly can. Some women may also have difficulty with breastfeeding and producing enough milk due to PCOS, especially in an uncontrolled state. Overall, it is very important to know that even with PCOS, you are able to go through pregnancy completely normally with a healthy baby and be able to support your baby, including breastfeeding, very, very, very well. Work with your providers and talk about the changes that you may be experiencing so that we can help you along the way. Now, if you're questioning whether or not your hormones or your lifestyle is impacting your body and your pregnancy in a way that can be significant, I'm inviting you today to take my free quiz, which really will kind of dive into your lifestyle and give you a little bit of maybe some tips and guidance. Okay, so I'm not going to give it all out to you, but I'll give you a little bit of information to help you a long way as you go through your PCOS journey, especially in pregnancy. Thank you so much for being here today. If you'd like to read more about PCOS and understand how the condition may affect your body, I welcome you to read a blog that I have written that really breaks down all of PCOS for you, and that's at the link in the description below. If you like this video, go ahead and subscribe to this channel, and of course, share with someone who may benefit from some of the information we talked about today. Thanks again for being here. I'm Dr. Perkins, a board-certified OBGYN, and it's my pleasure to discuss these things and so much more right here on my channel. Thank you.